Dr. Sanjay Dhawan. I'm the Director and Head of Ophthalmology at Fortis Memorial Research Institute, Gurgaon. I handle the eye department over here. Our department is a very comprehensive eye surgery department covering all the areas of eye care. And I personally specialize in the field of cataract and refractive surgery, which includes lens implant, LASIK, ICL implantation. I have been in the field of ophthalmology since 1992, so that makes it 22 years of experience in the past. I have worked in various institutions like Guru Nanak Eye Center, Lady Hardy Medical College. I've had the opportunity of being a faculty assistant professor in a medical college in Nepal for 2 years. Prior to Fortis, I was the head of the Department of Max Healthcare for good 11 years. I also worked as a director at Vasana Eye Care, and now for the last 2-3 years I'm here at Fortis. And it's been a good journey in ophthalmology, and more than the specialty or the science of ophthalmology, I emphasize more on a personalized care to the patient. What I feel that these days what is lacking is a personalized one-to-one care with the patient. We tend to deal more with the patient more as an object rather than a person as a whole. So dealing with the patient as a person, it provides a better care, because many a times, besides there being a physical disease, there are also elements which are affected by the patient's emotion, patient's lifestyle, patient's aspirations, which get missed out when we become too scientific and too technical about At Fortis Memorial Hospital, we're dealing with all kind of eye diseases, starting from pediatric diseases in young children to the diseases of the age-old like cataract, retinal diseases, glaucoma, corneal problems, plastic surgery of the eye, and various other things. So, as I said, that my area of specialty is the cataract and refractive surgery. So cataract is one of the most common causes of blindness in old age, though cataract can affect any age, right from the child, a newborn child, to the old and aging. But most commonly, cataract is seen in people who are older than the age of 55. There are various ways of dealing with cataract. However, currently the word preferred method is what is called MICS, the micro-incision cataract surgery with a lens implantation. Newer modalities like femtosecond laser is also coming in a big way. However, that still needs to stand the test of time. My preferred way of dealing with cataract is MICS with the implantation of a foldable lens. The advantage of this technique from the point of view of the patient is very short surgery, it's a very comfortable, painless surgery with very rapid recovery. Patient needs to be in the hospital only for 3-4 hours, and patient can resume most of the normal activities from the next day. There are two broad types of lenses used for this surgery. One is the unifocal and the other is multifocal. In unifocal, the distance vision is quite clear, and there is not much need for glasses for routine moving around. However, for reading fine print, whether near or say a bottom line of the television, small glasses power is required. Whereas in multifocal, there is a power for both distance and for near, so the need for glasses is minimized or completely eliminated. However, both the lenses have got their advantages and disadvantages. LASIK is another area where we excel at Fortis Memorial Research Institute. We have one of the latest and the fastest LASIK technology, used as Allegretto Concerto 500 Hz. We do SPK LASIK, which provides a long-term safety for the eye and also provides better visual results. The most important step in LASIK is the screening of the patient, where it's determined whether the patient is a suitable candidate for LASIK or not, because not all people are good candidates for LASIK. So we devote utmost time and effort and care to select the right kind of patient, and then we perform the LASIK for them. And as a result of that careful selection, our results are also good. However, which means that we do reject a lot of people from going in for LASIK. Talking about seasonal eye care, the problems that are encountered with various seasons is usually in summer months you have an allergy to heat, dust, pollen. There are also dry eye, there's also irritation, conjunctivitis that happens. People start going to swimming pools more often in summers, so the risk of spread of infection and conjunctivitis is much more in summers. In winter months, the dry eye is more common as the weather is cold and the air is dry, and there are some allergies show up in the month of winters also. However, around the year, one needs to take good care of the eyes, especially in the form of washing the eyes once, at the most twice in the morning or evening with clean water, and proper sleep, proper distance from the reading material or the computer screen is required. Enough breaks in between your work is required, and you must do regular eye exercises to strengthen your eye muscles. when you go out, if it's sunny, windy, dusty, you should put some sort of eye protection, maybe in the form of sunglasses in the daytime or plain glasses at night time. And if you find any difficulty in your eye, any problem in the eye, you must consult an eye specialist at the earliest. Never ignore your eye problems.